Here is sections of what appear to be gallbladder tissue to me. You can see that the surface epithelium is denuded, obviously because of surgical manipulation. But there's some rachitachy sinuses glands here, and as we continue to peruse around, you can see that the gallbladder is indeed inflamed, as you see here, and there are some accessory ducts in the wall of it. You can see some of the inflamed tissue here. But as we continue to peruse around, I wanted to show that there was fibrin blood clot around this gallbladder, or I presume what is presumed to be retained gallbladder tissue from the surgery. But I had a better view than this, and I'll go back and you can see some of the inflammation here in the wall here of the gallbladder. That's nerve. And so let me go to another view. Okay, here's a little sinus tract in the gallbladder here. I still believe that this is residual gallbladder tissue. It's difficult to say because it's not surfaced by the epithelium, and which has been denuded, obviously, from surgical manipulation. But I'm going to go to another portion of the image. So this is acutely inflamed fibrin blood clot material, and it's adjacent to the gallbladder as well. I'm going to continue to peruse around until we see the gallbladder tissue, which would suggest that this is an inflamed fibrin blood clot here. But it would suggest that there was surgery gone awry, inflamed surgery. Surgery that may have been complicated by obviously abscess and inflammatory component. But no, I'm keep on perusing around because I thought I had gallbladder tissue right adjacent to this inflamed abscess to fibrin clot, but not yet. Let me go to the next slide. So here is something. No, that's still fibrin clot. Let me go to the next slide. So here's better evidence that the gallbladder was not removed. This is gallbladder tissue. You can see it now better. So the gallbladder was not removed. This is all gangrene gallbladder, and the family was told that she had gallbladder surgery, and but this is clearly gangrenous gallbladder. It looks like it's just ischemic gallbladder tissue. I don't see any residual inflammation in this gallbladder. This looked like maybe from all surgery, but the gallbladder is still here. And I wonder if, so you have to wonder about the true pathology of the gallbladder from these imaging studies. And that's what you can see, some glands in the wall of the gallbladder, which are normal. Obviously some chronic rachitachy sinuses glands, but don't see much in the way of acute inflammation in this component. But as I've shown in now we're getting into something here. This is clearly gallbladder tissue. We see some bile mixed with hemorrhage and inflammatory detritus stuff from the surgery. Again, there's inflamed fibrin blood clot that I've shown before. So there's a lot of explanation to be done in this case. This is one of the worst cases of pneumonia after surgery. What was expected to be routine surgery for gallbladder removal. And you can see that all the alveolar spaces are essentially expanded by neutrophilic abscess material. This is really bad, and I can probably, again, one of the worst cases of pneumonia, post-surgical pneumonia I've seen. And the person ultimately died from sepsis after surgery, and also hemorrhage. This is a case where I show that there was frank blood in the abdominal cavity, fibrin clot that I removed, over 500 cc's of fibrin clot in the pelvic gutter. So this is surgery gone awry.